Good evening, good to have you with us on this edition of the Urban Debate at 9 p.m. We now put the focus on essential goods supply and just what has been the process so far. Do we need to change it? What are the key hurdles? Just going to do a basic status check. It's been 30 days, viewers, exactly since the lockdown was imposed in our country. And while in the initial few days, there were a lot of challenges and hurdles in ensuring that your daily food and medicines continue to come into the market and reach your doorsteps. We've come a long way from that, and there's been a significant amount of improvement. In fact, on a majority, one would say, there have hardly been any reports of shortage of key food and key medicines in any part of our country. So that being said, what is the next challenge? What else is it that the industry wants to look into? Yes, while the big retailers and the big e-commerce giants are able to get in the manpower now, get in their transport in place and deliver the goods, it's your next door kirana wala who's still struggling with the rules and regulations as far as distribution is concerned. There is still a problem. They still run out of goods very quickly and struggle to stock it up again. Let's look at that problem and the few other issues. So I'm just going to list out what the industry has been saying. One of their appeals to the centre has been on the transportation front. So the Transport Association has actually asked the government that most drivers have now gone back to the villages. So what do? We also want you to give insurance to the truck drivers. There is some amount of incentive that is needed to get these drivers back into work. Right now, this is one of the biggest problems to get more trucks on roads. The retailers are saying that several daily goods are still in short supply, that suppliers are not coming to the shops. Again, the suppliers don't have enough manpower available or transport available to deliver these goods to the last mile, to your kirana wala ka dukan. The distributors are saying permit companies that practice corona protocols, so allow some more companies to start working while keeping in the basic protocol in mind. They're also saying production severely hit due to the lockdown. There is a last mile delivery problem that we are still looking at, and we face shortage of staff and vehicles. And you will know this, viewers, because in most areas, even in our big cities, the shops, while they're allowed to be open 24/7, are only open for 3 to 4 hours every day. They can't manage more than that, again, because of supply and manpower shortage. And of course, the e-commerce guys are saying allow delivery of non-essentials in non-hotspots at least. Warehouses and transport system continues to be a struggle. We'll come to that. The non-essential part also. What other products need to be added into the list that you want, that the industry wants to give, that the government perhaps can look at? Let's say good evening to our panelists who are joining us right now. Mr. Dilip Chenoy, Secretary General for FICCI, joins us this evening, and Vikram Badhwar, General Secretary for New Delhi Traders Association, also with us. Mr. Chenoy, let me come to you first on the issues that are still being faced, and largely it's still about manpower, how to get them to drive the trucks, how to get them to work, their own logistics and transportation. That still plagues the entire supply chain system.
Thank you for putting that beautiful perspective at the beginning of the show. So if you look at India actually in different states, you have different types of operations that are being allowed. In some states where you mentioned that truck and movement is allowed 24/7, there are no drivers. In other states, delivery is being restricted into certain times or by certain kilometers. So there are a lot of different interpretations of the MHA order across different states that are impacting a number of companies in a different manner. There's also a different interpretation about which shops can be open for how long. While you said that shops are allowed to be open 24/7, that is not necessarily so in many states and in many cities. Timings are being restricted. You've been asked to close. In some cases, if there's a shop that is selling essential items, it also stocks non-essential items. People are saying that don't, sell the non-essential item, etc. So there are problems on three fronts. One, actually, even for some of the factories who are situated in border areas. So let's say you're in Baddi and you get workers in from Haryana, and even if you're manufacturing essential goods, you can't actually manufacture it because the workers are not allowed to be going, even if you have your own transportation. If you look at other parts of the country, in Goa and Maharashtra border, there's a similar issue. Daman and Vapi also, there's a similar issue. So labor movement is actually getting constrained in one manner. In the small and medium companies where they can't arrange transport but people live close by, I mean those workers also are not allowed to even come by cycle or walk down or whatever it is. People are insisting on actual transportation. The second is in the distribution chain. So many companies want to distribute, but they're regulated by passes given by different cities or by different administration. And typically the number of passes given to operate it is much lower than what you actually have applied for. Even if you say that I'm only going to get 20% of my workforce and this is 20% of my workforce and I want people, that is not happening. Similarly for the Kirana stores, for their workers, even if they live close by, it's very difficult for them to walk and get to the store, or for a vehicle to move from a warehouse and deliver goods in different areas. So there is a manufacturing problem, there is a distribution problem, and there's a sales problem. And it varies across sectors, across different states and cities, because the local administration is empowered to decide what they can allow or not allow. So there's a difference in interpretation as we go forward.
Okay, that gives us a lot of insights into the various problems that are currently happening and need to be addressed. Mr. Badhwar, can you add to this? What is the situation as far as the traders are concerned, the issues that still need to be addressed by the government?
At the moment, what Mr. Dilip has said, it's absolutely true. But as a trader, I've been talking to trade people. They are saying that what's going to happen? What is the government going to think about the traders? The main thing is everybody is running short of cash. Not a single person has got a cash at the moment. And everybody is on EMIs. How do they pay the EMIs? How do they pay the salaries? There's a big problem at the moment. Whatever the government is thinking, they should think fast. Otherwise, we are going to be in trouble, and the backbone of the industry or the trade is going to go down. The government should take out some drastic measures. They should do something about GST. They should do about some, I think I have heard that they have done something about PF. But if they're going to do real fast, then only India is going to survive. Otherwise, the backbone of the industry will be finished and Indian trade will be totally finished. The small SMEs, you can say anybody, we are talking to everybody, they're saying who's going to pay the rent for the shops. Although the government is saying they will say you don't have to pay the rent. But what will happen the moment it opens? There would be too many cases going in the court. There would be too many cases going to the labor court also. I don't think so everybody's got the money to pay to the laborers also. And how can everybody pay to the laborers if they don't have? They are running on loans. And if everybody is on loans, I can say 90% of the industry of traders is on loans. What will happen? Nobody is thinking at the moment and nobody is giving any relief. If earlier, what we have seen, if there is any drought or they give a relief for farmers and everybody. But at the moment, they are not giving anything to the traders. They are not announcing. They're just ordering, you do this, you do that. But you have to think about the future also. I don't want to add what Dilip ji has told.
Mr. Badhwar.
What he's told absolutely correct.
Yes, go ahead, finish your point.
You can go ahead.
Okay, now I was going to actually ask you about the availability of manpower. Is that a problem as well when it comes to distributors, moving the entire goods from one place to the other? We understand that a lot of, the smaller grocery stores and retail stores are not able to get the stock at this point of time because, there isn't transport or manpower available, and of course there are restrictions on movement.
No, I would beg to differ in that. there are differences.
Okay.
If people are saying they are not able to get it, this is wrong. In Delhi, I have seen, anybody kirana store wants to go to Kharibali to buy his grains and all these, it is available. And they've got their laborers there, they are helping them. Everything is going smoothly. Even the Delhi minister, Mr. Imran Hussain, he was there to help the grain merchants to get them opened and everything. They've got the timing, they've got everything systematic going on there. That is not a problem. But after the lockdown, what will happen if the workers don't come back?
Yes. Okay, you have raised an important issue. Let me see if I can go back to Mr. Chenoy on that. Mr. Chenoy, huge amount of concern also about, what happens, say, a month from now, when economic activity begins to pick up, when there is some more relief given, whenever it happens, from May 3rd or, in June, whenever. There is a lot of anxiety because the government doesn't seem to be giving direction at this point in terms of how will the industry be helped. What is it specifically that one would seek from the government?
No, so you heard, from a trading point of view about issues relating to working capital, issues relating to waiver of, fixed costs or rentals or deferment of rentals and, electricity, etc. So, I think when there are two issues there that we are actually now discussing. The first issue, I just want to actually make one statement that if you look at, the different empowered committees in government, they are actually working to solve daily, issues on the ground. But one of the big things that everybody is struggling to actually resolve is getting the drivers kind of back. So that is one issue which we have to really address. And therefore, to get drivers back, people are saying that we need to give them insurance. We need to help them, get confidence that they will be able to actually have a schedule that enables them to keep in touch with their family, etc. So people are looking at that. In terms of manpower, now is the harvest season. So a lot of people want to go back to their villages and participate in the harvest season, and they get paid Manrega wages, etc., which they don't get if they stay back in the city. So that's another issue that needs to be addressed. Then if you look at small businesses and other businesses, etc., a lot of people, there are people who have taken loans from the bank and there are people who have not taken loans from the bank. So the people who have taken loans from the bank and have got a financial system need to, the RBI has announced a moratorium on repayment of principal but not an interest. In many other countries, there are mechanisms for interest subvention by the government. That could be considered in India too. Then also for those people who don't have access to banking, or even those people who have access to banking and their profitability is substantially lower than 2 months of wages, they need wage support. The medium and small industries need wage support. A lot of medium and small industries and traders who are not in the banking system and who actually earn and then kind of rotate the money, they would need some sort of financial assistance package for them to meet not only their operating or their working capital requirements, but also to tide over in terms of paying wages and other dues going forward. So you require cash assistance or interest subvention now, which spreads over a longer period of time, because it's going to take at least 4 to 6 to maybe even a month to a year for business to get back to normal. So there are multiple things that could be done, and this is only these are only a few of the suggestions that I'm actually sharing at this point of time. But these are really top priority and cuts across every sector that you have.
Okay, and before I actually wrap up this conversation, very quickly, I wanted to check with you, Mr. Chenoy. There are also some voices that are saying that some more products should be included. We need to go a little bit beyond the essential goods which are there. What's the logic behind that? Simply to, restart some more economic activity, or what else could it be?
Distribution, right? So you allowed factories outside of municipal areas to start producing, right? if they produce an item which is non-essential, and if it cannot be transported and sold in a reasonable period of time, they're only adding to inventory and adding costs. So what the endeavor here is that at least those companies that don't have products in the market and are starting to manufacture, they should be allowed to be able. Those shops should be opened, etc., and those products could be available. The government has made an announcement in terms of electric fans because of summer. They made an announcement in terms of books because of the school session. So certain other products like kitchen appliances, water filters, etc., which are essential, and maybe going forward, water coolers. So that's one set where are seasonal items there which people need to produce, and many small and medium enterprises, entire year's livelihood depends on sales during the season. The second set of products whether people are asking is, there's a lot of inventory in stock, right? And even if they're non-essential items, some of those may deteriorate if they're actually stored for a long time. And production won't start unless the sales of those products begin. So when you're going towards a gradual easing of lockdown further, then can those products actually be introduced so that people can actually clear inventory and then create the whole process for production. For example, sanitary ware. When you allow the electricians and the carpenters and all to actually operate, then you need items that they require for repairing and for doing stuff which they earn their livelihood with. So these are some of the things that are coming in. But primarily, industry, government, and all at one. The first issue is that we need to contain, right? So contain this, and whatever continued economic activities that we can do in a manner that helps in the containment. That's the step that we need to take. Not risk exposure to everybody and then losing economic activity further.
Yes. In fact, I had someone tell me today that they're also, perhaps the government at some point needs to bring in products like mosquito repellents under the category of essential goods, because it's summertime, and at some point we will run out of the available supply. So that's also something for which manufacturing has to begin. So perhaps the government needs to have another round and relook at the kind of products that are being allowed to produce and step that up further. Thank you so much to both of you gentlemen for joining us on this conversation. We continue to keep a check on the entire supply chain issue, because this is essentially what really matters to you viewers. This is how you get your daily food supply, fruits and vegetables and staples and everything else that you need to get by even in these times of lockdown, as well as your medicines. So it's extremely important to highlight the issues so that the government can respond and fix it accordingly. Now let's move on. And we put the spotlight on the state of Kerala. Now, earlier in the day, I spoke with the Health Minister of Kerala on how is it that the state has managed to bring down the number of cases and what's going to be the next big hurdle. Here is that exclusive conversation with K.K. Shailaja, the Health Minister of Kerala, to give us an insight into how is the state of Kerala dealing and battling coronavirus and how are they able to defeat it so far. Shailaja, thank you so much for speaking with me. Let me first begin by asking you, Kerala was one of the first states to get hit by corona, and suddenly there were a large number of cases that were being reported. What worked in terms of strategy? Was it more on isolation, more about testing? What worked for Kerala?
Yes, we have a very good preparedness from the beginning itself. When the Wuhan case occurred, when the cases reported in Wuhan, at that time onwards, we are taking our preparedness and our precautions here. And before they come from Wuhan, we started our preparational work. We formed our state control room and 18 expert groups having different kinds of activities. And we started our all of our preparedness. We prepared our protocol and also the guidelines and standard operating practices, etc. And we give awareness to our 14 districts that some kind of virus is spreading in China. And there are so many Malayali students studying there, and they will definitely come back. And they may be carrier of virus. And we should have to be very cautious about this thing. And we started every preparation. As we expected, students from Wuhan came back on this, January 1st, January 3rd week, and we got some positive cases from Wuhan returnees. And at that time, we prepared very well, and we screened them from the airport itself. And the symptomatic cases we sent to our hospital isolation, and other cases we sent to home quarantine. And we got 3 positive cases. When the result came, all the 3 patients were in our hospital isolation, and from them, no other persons got this coronavirus. That first part is a very good victory for our preparedness and planning, and we yield a very good result. But at the time, we saw that the virus is spreading throughout the world, and at last, WHO declared it a pandemic, and we want to strengthen all our preparedness again. And we started, and in the airport, we never withdraw our airport surveillance scheme squad. They were working there continuously, and from Italy, cases came here. One case missed from the airport because they didn't reveal the identity, and from that family, the other persons also get virus, and contact cases occur. That became a cluster, and we tried best to prevent the community spreading. We at once traced the contact and isolated all the contact persons, and we started these isolation wards properly. That way, we prevent the community spreading in that Italy case also. And with the vigorous attention in each and every district, we give training to all the doctors, even in the periphery, primary health center doctors also, whether any case of the symptoms, sore throat, or minor symptoms like fever, etc., came to their hospital. They are testing whether they have any travel history or not. They are inquiring. That way, we find out all the cases here. And some peoples returned from
Okay.
Gulf countries here. And at that time also, we find out where they came, and very good home quarantine and symptomatic cases in the hospital isolation. On the part of test, we also conducted in a good manner. We tested more than 21,000 samples, and we got 447 positive cases out of this. And out of the 447 cases, 318 cases cured and left the hospital. 316 cases cured well, and they discharged from the hospital. Unfortunately, 2 deaths happened. But our mortality rate, the fatality rate is 0.5% only, and most of the people cured. Now we have 2 cases severely infected in the hospital. One is a 4-month baby. We are trying to save that baby, but that baby have comorbidities. Even by birth itself, that baby have some heart problems and also some respiratory problems for that baby, and we don't know whether we can save or not. We are trying our best. And other infected person, he also have some comorbidities, and we are trying our best to save. All other patients are stable in hospital. We have 129 positive cases in hospital today. And we expected more persons if the
Right.
lockdown become if the central government withdraw the lockdown, so many peoples will come back from the Gulf countries also. We are preparing for that. We are finding whether we have proper bed strength. We have now 160,000 beds in our custody in government sector and also in the private sector for Plan A. We have Plan A, Plan B, and Plan C. And in Plan B, we are taking more and more facilities. Even some private hospitals which are not working nowadays, we are
Okay.
taking that hospitals
Miss
also.
Shalra,
Yes.
Ma'am, if I may just take it issue by issue, and the details that you've given of what you've done so far, and it's good to know you're also prepared if more people come back home from the Gulf as well. I wanted to ask you about what has changed on ground in the last few days. Some amount of relaxations have been brought in. Now, after the central government's intervention, Kerala government withdrew some of those relaxation. But do you think the state is ready to bring in more relief, more relaxation, ease of movement for people?
Yes, our Honorable Prime Minister said that not only life but livelihood also to be considered, to be in our consideration. And that way, two districts we have, at that time we have no positive cases. And that district we declared as green zone at that time. And we gave some relaxations for agricultural works and other things. But we have to strengthen the stringent activities again. One or two cases reported from that district also, because the neighboring state have a high density of positive cases, especially Tamil Nadu and our Idiki districts, which we declared as green zone. We find that from Tamil Nadu, some people came there and they got infected, and we are taking stringent actions against that. And one more thing, for the personal hygiene, and for that we declared that some barber shops may be open with very precautionary measures. But central government said that it is too difficult to open barber shops at this period, and we closed that according to their instruction. That also we obeyed the central government. But wherever we lift some kind of stringent actions, there people are coming outside, and we have to again declare stringent activities or strict plans to make the people in their home.
Well, that was an excerpt of my conversation with the Kerala Health Minister. Let's continue with our focus on Kerala. And this is a very important issue that has actually become a big controversy in Kerala, viewers, but it's perhaps of national interest, and there will be learnings from what happens in this specific case. Now, I am talking about, and you may have heard about it, about the Kerala government sprinkler deal, a deal that they cracked and struck with a US-based company for an app that has been designed, a software that has been designed to track people who are in quarantine, people who are in various COVID treatment centers, and their health status on a daily basis. And now Kerala actually struck this deal in end of March and began using it from first week of April. Now, what really happened then was that the opposition raised issues about this specific app and software being used, and they raised a series of questions. This is supposed to be a tool for the government to track the health improvement or the health deterioration in various people, whether they're suspected patients, contacts of patients, or otherwise showing some symptoms, and this was supposed to help them make their strategy. But the opposition says that all of this database that has now been collected of people, their names, their addresses, what health ailments they have, what health conditions and symptoms that they are being showing, all of their personal details that have been collated together has been put into this software that is being actually created and run by a US-based company, and thereby there are now issues about privacy. There are now issues about the security of this data. The case has actually now gone to court, and Kerala government is currently defending its stand and its actions in court. In fact, let me take you through the details of what the petitioner's claim is and what the Kerala government has had to say in response, to give you a further insight into this big controversy. So the petitioner said that people had no choice in submitting this data, that their consent was actually not taken when this data was collated and put on this one software. But the government says that these submissions were actually made through voluntary self-reporting. The petitioner claims that the data has been stored with a third respondent, a US-based company that allegedly and reportedly also has contacts with a big pharma giant in United States. The state government says that it is stored on the government's web domain, and not on a foreign domain. But there's a controversy there because the domain also changed after this entire scandal really came out. The petitioner claims that the data privacy is at risk of being breached, while the state government has countered, saying no, the data is secure, it's completely in our control, and we will ensure that there is all privacy that's maintained. Now, this has also become a big issue because remember, the Kerala government and the left parties have been at the forefront of fighting for privacy and data security, had raised a series of questions when the entire Aadhaar project was, being implemented. So now, has there been some kind of a problem in the way this was done? Should you and I be concerned? And should citizens of Kerala really be concerned about this data that is now in the hands of a third party? Let's try and understand. Dr. Pavan Duggal, cyber law expert, joins us this evening, and Prasanth Sugathan, also a technology lawyer and voluntary legal director with SFLC, with us this evening. Mr. Duggal, let's begin with you to help us understand, should we be concerned? This is the health information of lakhs of citizens, perhaps, of the state of Kerala.
We should definitely be concerned because this is no normal information. As you said, it's health information. So in the eyes of law, it's sensitive personal data. And if you are, as an entity, dealing, handling, or processing sensitive personal data, then you are required to comply with various stringent requirements under the Information Technology Act 2000 and the Information Technology Rules 2011. It will have to be seen in this particular case how much of these compliances have been done. And the moment this kind of a data has gone into hands outside those of the state, then the responsibility of the state is going to be equally there. The state just cannot argue that, look, I did all that I could have. Although the state has a kind of an exit route under the IT Act, the state can always say that, look, I did everything in good faith, or in the normal diligence of my duties. And once they say this, then under Section 84 of the IT Act, they can specifically be exempt from any liability. But having said that, the other US entity is not going to be exempt from liability in any category whatsoever. So any affected persons can actually seek unlimited damages by way of compensation against these said entities, as the requisite compliances have not been done. In any case, the government of India is very, very clear that sensitive personal data has to be within the territorial boundaries of the country. And once it goes outside, this is no normal data. This is data pertaining to COVID-19. I think this could prejudicially be used against the people, against their privacies, and against even the sovereignty or security of our own country. So serious matter which requires serious consideration.
Okay, in fact, there have now been reports that show that earlier even the domain name for this software to be used was something else, and then later on it was changed to .gov, .in. So, should there be a concern at all, Mr. Prasanth Sugathan? Where do you stand on this specific story?
Yeah, thanks. The question is not about whether the domain is the government domain. The question is about the collection of data, the retention of data, and the processing of data. Now, we need to understand that it is quite fortunate that we are discussing the issues of privacy and data protection in India and not the health scenario. That definitely shows that government is doing something good, and that from the health debates, from the COVID debates, we have moved to data protection and privacy debates. That definitely is a good thing. Now, however, we need to understand the importance of this whole issue as such. The first is definitely about data collection. There are different sources from which the data is collected, from what I learned from the litigation which is before the High Court and from the various documents which have been produced. One, there are various sources from which the data is, let's say the government obtains data. One is by the information which is voluntarily given by the people. That's by persons who are, let's say, infected with COVID, and also persons who are under quarantine and under observation. So that is, they are voluntarily giving this data. The second is where ASHA workers and other the government staff, where they go to these houses and gather data from them. Now here we need to understand one thing. This is a pandemic situation. And the question is of whether there is consent, informed consent, etc., whether we can go into these details when there is a pandemic. One, even if you look at the Puttaswamy judgment, the privacy is not an absolute right. We need to understand whatever measures that even the central government or the state government takes, we need to understand this in the light of the pandemic situation that we currently have. So yes, we citizens do have a right to privacy, but then when there is a, let's say, overriding interest, when you need to look at the greater good of people as such, there can be some deviations from these rights. And again, when this is quite different from, let's say, people have been talking about mass surveillance and things like that, but here it's a different situation where the data is collected. It's more like in case of a targeted surveillance. You know whom you're talking to, and you're collecting data only from those people, and you're not looking at the entire population. It's not the entire population of the state who are being surveilled or whose data is being collected. You're just referring to specific people who are under either quarantine or who have been infected by the virus. So yes, it's a small collection as far as the data is concerned. So definitely the collection, we cannot go into the strict consent issues over here. Yes, but then when the data is processed, the data is retained, we need to look at the security issues.
Okay. Now, one of the arguments that's been given by the government to the charge that, well, you rushed into this, you didn't follow proper due process and protocol, and you did this, in a rush, is that obviously this is in times of pandemic. So yes, while the process was followed, the state government says at that point of time there was nobody, within the state of Kerala, no company available that had the kind of technology that we needed. Now, Mr. Duggal, I am just trying to understand. How complicated can this technology really be if the data is being punched in from what people are telling the grassroots workers or are themselves putting into this app? Doesn't any company in India have technology good enough for that?
Well, there are various companies within the country who do have the requisite technology, but it was the discretion of the government to pick up some entity, which the government did pick up. Now that the matter is before the High Court, the High Court will examine whether appropriate due diligence was done. And I agree these are pandemic times, but in these pandemic times, the Information Technology Act 2000 has not been suspended. It's a mother legislation. It prevails over anything inconsistent therewith contained in any other law for the time being in force, including the Epidemic Act, or including any other legislation that will be applicable in the scenario of a pandemic, because that will specifically be dealing with electronic format. So once you're dealing with this, the onus will be upon to the government that what kind of due diligence has it done? Because at the end of the day, the government, when it's handling or processing sensitive personal data, cannot say, I'm going to be oblivious of people's privacy. I'm not going to comply with the parameters of the Supreme Court judgment. And I did this because this was a pandemic. At the end of the day, the pandemic does not mean that you throw the existing jurisprudence out of the window. The pandemic shows, yes, urgent, immediate messages are required, but compliance with the rule of law is also equally important.
And I also have a larger question, and Prasant, maybe you can come in on that. How is this software or any other such app or software that tracks people's health information for the use of a government going to be different than a central government app? And across the world now we have technology being used to track and store people's health records. We have an Arogya Setu app right now that almost everybody in this country is currently trying out. So the concept is the same. It's just that we need to ensure that there are strong safeguards, isn't it?
Right. That is where I made this differentiation between a targeted surveillance and a mass surveillance. This as far as the government is concerned here, so at least from what I gather from the records which have been put out by the Kerala government and documents available before the court, which have been filed before the court. So what I understand is that it is a case of a targeted surveillance where only the section of people who are under quarantine or who are either, patients who have been detected with the COVID virus or COVID positive, their details are collected. So it is again a case of targeted surveillance. You are only surveilling people or collecting details about people who are affected or are become under the high risk category. So that is a different scenario here. Then coming to the question of whether in the case of Arogya Setu or this, yes, we in some cases, even if you look at Arogya Setu, the data resides in AWS servers and Google's Firebase. So just because let's say central government or the state government uses AWS or let's say foreign service provider, that doesn't mean the data is lost or a data breach happens. What we need to understand here is the kind of protections that you have either in the contract terms or the terms or in other terms which are entered between the service provider and the government. And also, of course, the provisions of the IT Act and other legislations that we have to protect the citizens.
Okay, I am currently out of time on this conversation, but it was great to have both of you to help us understand just what is at stake, how concerned we should be as this story continues. And of course, now it's up to the court to decide this matter as Kerala government defends its decision and puts out information. They're saying that, the data is completely safe and it is only in our control. But the opposition continues to raise questions. And of course, the petitioner has now raised some valid questions that the government will have to explain in the court of law. Privacy is extremely important. Pandemic or no pandemic, there cannot be a compromise on the privacy of the citizens of our country. And that's one thing that all governments must keep in mind. Thank you both gentlemen for joining us on this conversation.